Good morning. This is Dr. Wilshire at Missouri Fertility. This morning we're going to be doing surgery on a woman who we suspect has pelvic adhesions. Now, operating on adhesions is a somewhat controversial topic. Women generally form adhesions after an infection or a previous surgery. This woman had a surgery 3 years ago with us that was through a very large incision called a laparotomy. No matter what you do at the time of laparotomy, sometimes scar tissue can form afterwards. Now, whether scar tissue causes pain is very controversial. Scar tissue itself does not have nerve fibers, hence, scars themselves generally don't cause pain. However, if these scars involve other organs such as the bladder, the uterus, the ovaries, or the bowel, these organs can be compromised, and this can probably cause pain. We would like to go in and remove the scar tissue so that all the organs can sit where they normally belong. If there's no tension, if they're normally situated and they're not twisted, they should work better, and this woman's sensations of pain and cramping and discomfort should get better. Now, with women who've had fibroids removed, they tend to make more, so I wouldn't be surprised if this woman has additional fibroid tumors in addition to the scar tissue we suspect. We're going to do our usual bumper-to-bumper surgery. We're going to put a telescope in the uterus called a hysteroscopy and probably remove a small fibroid there. We're then going to do a laparoscopy with a telescope in the belly button and fix the scar tissue and whatnot up there. We'll put everything back where it belongs, we'll flush the tubes, we'll check everything, and hopefully she'll not only feel better after this surgery, but she'll also be much more fertile. This is Dr. Wilshire at Missouri Fertility. I hope this is helpful to you. Hello. We are now in the operating room with the woman in whom we suspected pelvic and peritoneal adhesions. Well, here they are. Please take a look at this. This is scar tissue that forms frequently after a large surgery called a laparotomy. We will take these adhesions down. We will hopefully restore normal anatomy, and hopefully she'll feel a lot better very soon. Here we are now at the end of the surgery to remove adhesions. Here's the woman's uterus. Adhesions are all gone now. The tubes are free. The tubes are open. She should feel a lot better, and this is a major success. I'm very, very happy with this. So, we've restored anatomy, and the patient should be able to go home in an hour or two. I hope you found this video helpful. Please like us on Facebook, subscribe to us on YouTube, and follow us on Instagram.